Welcome. I'm your host, Dr. Johnson, Dr. Sonia Johnson. So if you want to share this screen, just press the button at the bottom of the screen. Sharing is caring. And if you have a friend that you think should hear this message, just tag them. Okay, so we're waiting for some people to join us. And we're going to talk about some interesting thing, a whole new area, but it's still under procedures. Okay, so welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today we're going to talk about procedures like we've been talking about for a while now. And we're going to talk about we're going into a new area of dermal fillers. So like your hyaluronic acids, your Juvederm, Restylane, Radius, products like that we're going to be mentioning in the next upcoming live streams. But today I'm going to talk about the locations where you put these fillers. So for the locations, you're looking at the forehead wrinkles. You can do that when you have a lot of wrinkles that you see at rest. Not when you have facial expression or facial movement, but at rest. Now, fillers are not the ideal thing you want to use. You actually want to use Botox because that will get rid of the wrinkles. However, using fillers in the meantime will help. The lines are not as obvious until the Botox cause those wrinkles to subside. Now, when you're using the fillers, you want to build up the area. So if you think, okay, I inject the fillers right underneath the line, and it doesn't work like that because the fillers go on both sides of the line. Whereas if you just crisscross underneath the line, you're building up the whole area. That's the best way to get the results. And again, it's not ideal, but it will do something to help minimize the wrinkles on the forehead. Now, another good place to put fillers, and this is really the ideal place. I'm sorry, not ideal, but this is another way to use a filler. Just like the forehead is in between the eyebrows. We call that area the glabellar area, Glabellar. So glabellar area is another location where you want to put your filler injection. Again, this is the ideal spot for Botox. However, you can build up the area again and help with those deep wrinkles that you have even at rest. Forget when you're moving your making facial expression, but at rest also. So you can continue to inject the fillers until the Botox, over time, the Botox work and get rid of the filler, the wrinkles at rest. So let's see. Now, ideal area to put the filler is on the nasolabial fold. And the nasal labial fold is between the sides of the nose down to the side of the mouth. Those two lines that become more prominent as we age. Now, when you're injecting the filler there, again, you actually are injecting it underneath the line, and that actually will raise up that line there and make it invincible, so you really can't see how deep it is because you are injecting a product there that's going to make it look natural. You're injecting the fillers usually in the dermal area, so it makes it look natural. You can't even tell you have anything injected, of course. So that's the ideal place. Another place that some fillers are used is at the nasal trough area, underneath the eyelid, the lower eyelid, of course. And that's to help with that circle appearance that a lot of people have, or that sunken appearance that your eyelids will give you as we age. And that's because you do lose collagen, but also you have a blood vessel there, a venous blood vessel, meaning it's purple, deoxygenated blood. And it makes that, and because the skin is so thin, it makes it look darker than it really is. But again, because you have loss of collagen there too, it makes the area, the blood vessel appear darker than make the area appear darker because you can see that blood vessel basically. So fillers are placed on the lower eyelid and also in the trough area, which is on the corners of the eyes, to help diminish the discoloration, and also to help with that sunken appearance of the eyelid, or that shallow appearance of your eyelids as we age. Another good place to put a filler is your cheeks, those cheekbones. And it's really nice because a lot of people don't even think about that. That's my favorite area to inject a filler, because you want to take off 10, 20 years easily, do your cheeks. So don't just go in and everyone asks for the nasal labial fold area. It's the cheeks, let me tell you, and do them both together. So if you're gonna get the nasal labial fold area done, but you're questioning the cheeks, well, if you are, do the cheeks first because you'll see instant results. And you'll see it again with the nasal labial fold area, but it's just so prominent on the cheeks. And then come back later and get the nasal labial fold area done. And that's because whenever you're getting fillers done or any kind of work done on your face, you want to start at the top and work your way down. So it can always look symmetrical and even, as well as the ratios is there. So like I said, if you're considering the cheeks, get that done first and then do your nasal labial fold. So of course, people want lip enhancement. And that is the corners of the lips, or I've had people ask me not only to do the ridges of the lips to help with the makeup, your lipstick, definite borders, but also to make the lips fuller. So I will inject a vermilion border, which is that hold the lip itself, basically. And another area that we use fillers. Of course, you will get the fillers that are not as thick to place there because as we talk a lot, the fillers will become beaded, little beads if you have too thick of a filler injected in those areas. But on the lips, and of course, when you inject fillers on the lips, it's going to hurt more because your lips have a lot of nerve endings there. But if you want enhancement of the lip line or make the lips fuller, you're looking at a filler for that. Another common area is the corners of the mouth. So I have a couple of patients actually, they get what we call perlech, P-E-R-L-E-C-H, and really apostrophe E. And it's actually candidiasis is what the cause of it is yeast. And what happens is the corners of the mouth over time, or they have, when your lips are together, if you look at the corners of your mouth, if they turn sideways, just straight across, or turn downward, then as you're talking, a lot of times you get fluid from our saliva gets trapped in the corners of the mouth. And it stays there if the corners of your mouth are sideways or turned downward. And what happens, a person tend to, because of like stagnant water, it gets infected. And our bodies have yeast everywhere. It's ubiquitous. But you have moisture and you have yeast and warmth. It overgrows. And so they tend to get a dry area, sometimes even a cut or a slit. We call it fissure in dermatology world, but it's a cut in their corner of their mouth. And that's because the yeast overgrows, it dry in the areas moist, it dries out the sides of the mouth. And as you're talking, you don't have the suppleness of the skin at that point is dried out, so it tears. And that's how you get the slit. So we use fillers. That's one thing you can do. Use fillers to inject in the corners of the mouth. And when I do that, I actually turn the corners of the mouth upward. And by doing that, it helps. So when they're talking, the saliva, it may enter the corner, but it actually doesn't stay. It goes back into the mouth. So therefore, they don't have that problem anymore. So that's one way we can actually use fillers, besides surgery, of course, to correct that situation. Now, aside from that, there is, we use fillers in the marionette lines. You ask yourself, now, where are they? Where are they located? Marionette lines are on the sides of the mouth and the lower part where the chin is, on the sides of the chin. So in this area here and here. And the marionette lines are lines that, little lines that form over years of collagen loss. So, as we age, that area, you start to see lines there. And we inject fillers there also. The key is you can't put too much there, because if you put a lot of filler in that area, you would look like a little. So we want to make sure you don't put too much there, but we call that area the marionette lines. Another good place you can put fillers is, I like on the dorsal hands, on the top of the hands, because as we age, you notice your or tendons become more prominent. Your skin, of course, is thin, and it doesn't feel thick like it used to. And so we can put a dermal filler there. I use one of the thicker ones that lasts about a year. and we put it in that area, just inject, and I have people to sit on it and make it warm. And when they do that, then I can move it around. And so the hands look supple and thicker, and it doesn't look aged. So those are the areas that we can use fillers. Off-label, of course, you can use fillers for scarring, areas where you have a depressed scar, and you can inject the filler underneath the scar and it raises it up. So if you have a scar that's depressed, this is where filler is really nice, that you can inject, like I said, underneath the scar. And you sort of break up the scar, the adhesions underneath the scar with a needle, and then you can inject the filler so it can raise the scar up, and it can be even with the surrounding skin. And so these are ways we can use fillers to give you that beautiful skin and what you're looking for and help you achieve your goals. Now, I have a product that I like that we sell. So for our patients and clients who do purchase, get the fillers injected, in between their times of injections, if they're out of town and can't get to us fast enough, or the fillers, they can't be costly, so definitely they need something to hold them over until they get their next injection. We sell a product called Wrinkle Free Serum at our office, and what it does is it's in a bottle, it's liquid, and it helps your body to make amino acids that help mix collagen. So I'm sorry, it's a bottle with amino acids in it, and it helps your body to make collagen. So you just rub the serum in the areas where you want the collagen to grow or to build up. And so you do that twice a day, every day. The bottle lasts 6 months to a year. It's just, first of all, the areas you're trying to increase your collagen production is usually not big. But then number two, it's not a big area. But then number two, it's a liquid that you're using, so it goes really far. And what I like about it is it doesn't cost much, but it lasts a long time. You see results within 2 weeks. No irritation and no scent. And it just helped that filler that you just had injected, when you're near the end, when it's time for another injection of fillers, that you can use that to help prolong until you're ready for that next filler. Okay, so this is an option for you, and for people who don't want the fillers, because with fillers you have to have an injection. I have a lot of people who don't care for needles, and the filler can do that. This Wrinkle Free Serum can do that for you. So again, you just on a clean surface of your skin, wherever you want the collagen production to occur, let's say your nasal labial fold area, you just rub a little of the serum on twice a day until you get the results you're looking for, and then you just do a period after to maintain those results. But like I said, the product lasts a long time. So thank you again. Any questions for me? All right. Well, gorgeous. Thank you for tuning in to the Gorgeous Glow Skin Show. I'm your host, Dr. Johnson. I help women who want to have even and clear skin tone with increased confidence. If that's you, again, you're at the right place. And if you're interested in that Wrinkle Free Serum, just go to yes.gorgeous-skin-now.com. yes.gorgeous-skin-now.com to purchase your product. And again, if you purchase over $200 worth, you will get free shipping for people, a free gift with that, and a discount on other products. Then you want to go to that website. But if you just want to go get the product by itself and not forget the free gift and also discounts, then go just to GRxSystem, which is the product line, GRxSystem. Take care. Have a wonderful day. Bye.